I'm not gonna lie to you guys, you should get this right. Okay, and if you don't, like the lady says, you're a menace to society. I would take notes and color coordinate them to match the card. But Med-Surg clinicals are very, very exhausting. Like you'll see, Zoe, how did you survive Med-Surg?
And it goes a little something like.
Hey guys, it's Zoe and welcome back to Zoe and Amaya. And today we're diving into term 9 of ECPI's 8 AM program, which is Med-Surg. So I'm breaking down what the class covers. I'll probably briefly go over what my clinicals were like, because at this point you already know what clinicals are like, and how I survived the intensity of adult care, specifically Med-Surg, which is not my favorite. I cannot stand Med-Surg. Before we get into today's video, make sure you like, comment, subscribe. We're on the road to 4,000 watch hours, so every single view generally helps us grow and sharing this video with your fellow nursing friends. So for this class, it focuses on adult patients with acute and chronic conditions. So you're learning cardiac disorders, respiratory issues, diabetes, electrolyte imbalances, GI problems. You're not just memorizing symptoms anymore. You have to actually know like what to prescribe the patient and stuff like that. So what you have to know, what lab is priority, what complication is life-threatening, and what do I assess first. It's always what does the nurse do first. So this is where critical thinking becomes everything, okay? Your ABCs, you'll learn that at the beginning of your nursing program. Airway, breathing, circulation. So as for Med-Surg clinicals, I'm not going to like go too in depth about it, but Med-Surg clinicals are very, very exhausting. Like you'll see more bodily fluids than you ever seen before. You'll do wound care, empty drains, and yes, students are assigned the dirty work more than ever. But here's the thing, like don't stress, okay? Because this is where you'll learn the most, even though like you're doing all the nasty work and stuff like that, you will learn a lot. So the hardest part for me wasn't the task, it was the pace, because patient changes are fast and you can't move slow. Like on a Med-Surg floor, there's a lot going on. You probably have 5 patients. I just recommend following your nurse when she does, well, depending on when your clinical start, because sometimes we would go before shift change and then sometimes we would go after shift change. But if you're going during shift change, which is usually like 7 AM, I would just suggest following your nurse, even if you're assigned one patient, following your nurse around to all of her patients, not just your one patient, so you can get a variety of things and see new things, and it helps out the nurse. So I always get asked, Zoe, how did you survive Med-Surg? Especially clinicals in the class. I'm going to dive into that a little bit here. So when we had clinicals, I would make sure that my nurse gave me access to the patient's chart and I would review like labs and all that stuff. I practice prioritization questions daily through the ATI and through YouTubers. And I stopped trying to memorize everything, just focus on understanding the why first. Because if you understand the why, it helps you grasp a bigger understanding of what's going on with the patient. Also for studying wise, I do have those notes. Like I said, I would have my bought level up RN cards, and those are like I bought the whole set, and those are $300. They're expensive. But what I would do is take my cards. I'm a visual and tactical learner, so I would take the flashcards. I would follow along with their videos because they will review specific flashcards, and then based on the flashcards and what the lady was saying in the video, I would take notes and color coordinate them to match the card. And I would make Quizlets. So if you guys want access to all my notes, just comment the stethoscope emoji. You already know the drill, you already know the routine. And I will send you my email, and then you can email me, and then I will send you my notes. So to help you guys get some practice in, YouTube came up with a new section, which thank God, it's called quizzes. So I'm going to do a little something different, and I'm going to add like 3 quizzes that will be linked down below, and I'm going to read them off right here. And I'm not going to say the actual answer, but I just want you guys to sound off in the comments. Did you get it right? Did you get it wrong? Let us know. Okay, let's get into question 1. A patient with heart failure reports shortness of breath and has crackles in both lungs. What is the priority nursing action? Is it A, encourage oral fluids, B, place the patient in high Fowler's position, C, administer stool softeners, or D, restrict potassium? All right, question 2. Which lab value is most concerning in a patient with kidney failure? I know this because I'm a dialysis nurse. But A, potassium 6.2, B, sodium of 138, C, a hemoglobin of 12, or D, glucose of 100. Let us know your answer down below in the responses and let us know in the comments. Did you get it right or did you get it wrong? All right, I think this is the last question. Question 3. Which patient should the nurse assist first? A, a stable diabetic waiting for discharge. B, post-op patient reporting 8 out of 10 pain. C, COPD patient with oxygen sat of 86. Or D, a patient asking for water. I'm not gonna lie to you guys, you should get this right. Okay, and if you don't, like the lady says, you're a menace to society. Please let me know if you got this question right, and if you got it wrong, why do you think it was the answer that you selected? All right, guys, that's it for term 9. Please comment the stethoscope emoji if you want some notes. Also, like, comment, and subscribe, and share this video with your friends if you love the quizzes section that I added. Maybe if you want some more questions, more than 3 questions, because I think for my next video, I also have 3 questions, but let me know if you want more than 3 questions and sound off in the comments. All right, I'll see you guys in the next one. Bye. This is editing Zoe right now, editing this video as we speak. But I forgot to mention, if you stay to the end, then you'll see this clip. If not, you won't see it. But like when I mean during the clinicals, you get assigned the dirty tasks. Me and my guy friends we had a multiple clinicals together, and this particular Med-Surg floor that we always got assigned to, especially during Med-Surg class. I think it was because during this Med-Surg class we had a patient, and of course, as being nursing students, the nurses had us do this. There was a patient that was having multiple bowel movements within 5 minutes of each other. Multiple bowel movements within 5 minutes of each other, and we were there for 8 hours. Granted, he started doing the bowel movements like towards the last 2 hours, but that was 2 hours of cleaning up this patient, and they had us do it. So have fun during your Med-Surg class. You want to get assigned, they dirty work, and it was not fun. And he was given iron, and his bowel movements smelt like straight iron, and his bottom was red as heck because we were wiping him so much, and he was having so many bowel movements. So congratulations, you're almost done with nursing school. See you. Bye.